Happy Thursday. Many thanks for joining the program, The News in Detail, with me, Gloria Mutesi. Starting us off tonight, Imbuto Foundation has donated equipment to the Rwanda Biomedical Center that will assist health counselors in their work of advocacy in the fight and prevention of the COVID-19 pandemic. Among the items delivered included face masks, thermometers, face shields, and phones to assist in the communication process. Councillors across Kigali City acknowledge that they play a role in the fight against the spread of the pandemic. Before the news gets to everyone, it's us that distribute that news. That makes me happy because I do my job wholeheartedly while being happy at it, and residents listen and understand what we tell them. It's for this reason, the contribution of the health counselors, that the Imbuto Foundation donated equipment to them through the Rwanda Biomedical Center. Ingrid Karangwarie from the Imbuto Foundation says this is to support the health counselors in their work.
We believe that it's our mission with our partners as well to really put emphasis, and we can't keep repeating this. COVID is a war that we are all fighting, and we need to all come together and put our forces together to support the people who are on the ground, who are on the community, as we roll out all the vaccines and keep putting the measures in places.
The head of the Biomedical Services Department at the Rwanda Biomedical Center, Dr. Gatare Swibe, acknowledges that Imbuto Foundation has always been a supporting partner to them. They recently gave us a COVID-19 testing machine, which has helped us test many residents across the country for COVID-19. We are grateful for this partnership with Imbuto Foundation because of the development coming out of it. The items that were delivered were 133,500 face masks, 2,200 thermometers, 2,910 hand sanitizers, 2,400 face shields, and 206 phones to assist in the communication purposes. To education matters now, parents in Musanze district are happy that they no longer have to worry about getting access to quality education for their children, as new advanced schools have already been established in the district. Some of these schools now offer lessons based on the international curriculum. Jane Mutoni.
As of now, parents in Musanze district with children who are starting kindergarten or elementary school and primary are no longer anxious about which school they will send their children off to. Unlike in recent years, where many parents took their children to study outside of Rwanda, crossing the border, or to Kigali City, there are now various private educational institutions in Musanze City with quality education. Mukayuhi Leah, whose child won first place in the country in 2019, she and other parents say that at some point it was difficult to find a good school in Musanze for their children, but now quality education is accessible. We were happy about this progress and also surprised with the capabilities of the school, as students benefit a lot from there. As parents, this is a relief because we no longer have to send our children to study in other countries, and it's also expensive and hard to keep track on their behaviors. But now we have good schools near us. As students in primary 6 prepare for the national exam, they believe they are ready to pass them.
I'm preparing my national examination by first understanding what my teacher tells me, and then I do the revision of what we learned.
We do very many tests because you are candidates to do PLE, and you don't have fear for PLE.
Duwayezu Eli is the owner of Wisdom School. He and his colleagues who chose to invest in education testified that the main goal of establishing schools was to bring better schools with quality education near for parents to send their children to. It was also to support the government in promoting education. Education is the foundation on which everything else, or project, is built on, and that's why we chose to invest in it, as a way to contribute to the development of the country. In Musanze district, there are 50 private schools, including secondary schools, with a total of over 11,000 students. Some investors say there is need for more investment in order for more children to have access to quality education.
cyambere abanyarwanda dufite umubare munini w'abana batoya mu byukuri akeneye ubundi
The number of children is very high compared to the private schools available. Even though the government is constructing more classrooms, more investment is needed so that more children can benefit or have access to quality education. Among the goals of the government is to provide quality and accessible education to all and to accelerate the development of a knowledge-based economy. Rwanda's education policies and strategies are based on three main pillars: universal education, quality education, and education related to the needs of the labor market. Private sector investment in this sector supports the government in building education programs that lead to further development of the country. Jane Mutoni, RTV News.
Many thanks, Jane Mutoni. Now, earlier this week, the MasterCard Foundation announced a partnership with the Africa Centers for Disease Control and Prevention, where $1.3 billion will be deployed over the next 3 years as part of a new initiative to acquire and deliver vaccines across the continent. Ms. Rita Roy, the president and CEO of MasterCard Foundation, spoke to us about, among other things, the nature of this partnership and that it's based on 4 elements. Take a look.
And it covers 4 areas. First is to acquire vaccines for at least 50 million people. Second, it is to support the rollout and the deployment of vaccinations to millions more across the continent. Third, it's to lay the groundwork by developing the human capital, the human workforce for vaccine manufacturing on the continent. And fourth, it's to strengthen the Africa CDC as well as to enable it to oversee this significant initiative. So the beneficiaries are the African people. That's number one. And we need to mention that equity and inclusion are really critical anchors of this partnership. And so as we start to work with different countries to understand where they are with their vaccination plans, that's how the rollout will begin. And as you may have seen, WHO, the Africa CDC, and different ministries across the continent have prioritized segments. So first and foremost, healthcare workers. Second, people who are elderly or people with particular underlying health conditions. But the goal here is to vaccinate as many people as possible so we get as close as we can to the target that's been set by the African Union, and that is to vaccinate at least 60% of the population of the continent by 2022.
And how soon will we start seeing the results of this project?
Well, work is already underway. Next week, we begin regional consultations with ministries of health to understand the status, both in terms of their vaccine supply, what they have purchased, what they may have already planned through bilateral relationships, as well as where they are with their actual vaccination rollout. What are their needs? Is it for more training of healthcare workers? Is it to stand up vaccination centers? Is it around pharmacovigilance to understand adverse effects for those, in rare cases, to get the real sense of what those needs are? Vaccines under this initiative are destined to arrive in the early part of August and then progressively in increasing amounts.
And as you said that the goal is 50 million Africans to be vaccinated in the next 3 years, but for a continent that's over 1 billion people, one could say that it's a low target. Is it lack of resources, or what's your thoughts on this?
So the goal is not 50 million people. The goal is for the African Union's goal, which is to vaccinate at least 60% of the population. That is close to in the neighborhood of 750 million people. So let me situate this for our listeners. When we began this initiative, we really wanted to understand what was coming to the continent. And as you may know, there is a facility known as COVAX, which is a global facility, which is providing vaccines to many countries around the world. And there is also an initiative led by the African Union. It's called the African Vaccination Acquisition Task Team. Or the shorthand is AVAT. So between COVAX and AVAT, the continent is expecting to have sufficient supply for anywhere between 50 to 55% of the need. So there's still a gap to be filled. And our purchase is trying to help get closer towards that target of 60% vaccination. I hope that's clear.
Yeah, definitely. And are there any measures or conditions that the MasterCard Foundation has in place to ensure perhaps efficiency and effectiveness of this initiative?
Absolutely. First and foremost, we have put in place a steering committee between the foundation and the Africa CDC. We will be involving numerous implementing partners who are part of this initiative. The good news is we're not starting from scratch. We are not creating parallel systems to ministries of health. What we're doing is getting behind the work which is already underway in multiple countries through ministries of health. So we want to coordinate with them, we want to expand and to augment and even accelerate their efforts.
We've known, Rita, we've known education and hospitality to be the main key areas that the MasterCard Foundation works with. Is the decision to invest in healthcare a long-term project, and what are your future plans?
You've rightly said, the MasterCard Foundation was set up in 2006 to do two things. One is to advance education, and the second was financial services for the poor. And more recently, we have developed a strategy known as Young Africa Works, which is to drive opportunity for young people in parts of the economy in their country which is growing, parts of the economy which require skilled workforce. And in Rwanda, health and hospitality is a major area. But in light of this pandemic, we will also be looking at other areas. And the healthcare sector, if you look at it just through an economic lens, has huge potential. And it is also a sector which can offer numerous opportunities in terms of occupations as well as careers for young people. So that's a very critical sector we'll be looking at going forward.
Well, thank you so much, Ms. Rita Roy. It's been a real pleasure to speak to you, and thank you for your insights.
Thank you very much for this opportunity.
Well, in other news, people who have experienced severe depression are encouraging others currently facing such mental illness to seek professional help because they can be assisted to overcome them. Sarah Nori with the details. My mother would say very hurtful things to me.
Hate from one's own mother can push a person to the edge, to the point of attempting suicide.
I opened the bottle of rat poison and drank it all because I wanted to die. It burnt my insides until I started vomiting blood.
This suicide attempt would lead to a 3-month hospital stay and counseling to overcome the depression that nearly took her life. Others too testify that counseling does help people pull themselves out of the darkest of episodes in their lives.
You feel like life is hopeless and thinking of making any progress is impossible. You feel like you have no future.
You cut and burn yourself and do other terrible things to your body in attempts to drown out the pain you feel inside by inflicting other sources of pain on the outside. It happened to me, and I bear the scars of the places I would willingly burn my skin. Mental health experts at the Karayes Ndera Neuropsychiatric Hospital say the establishment has over the last 3 years diagnosed 3,000 people with severe depression, and that the general public should take this problem seriously. If you notice that someone no longer enjoys things they used to and are suddenly reclusive when it was not usually how they behaved, you should encourage them to seek professional help because it is clear that severe depression is on the rise among people. In 2018, the Ministry of Health found that 20.5% of the country's population suffers from some form of mental problem, with 11.9% of those people struggling with severe mental depression and exhibiting signs of self-loathing and being tempted to try and commit suicide.
47 military and police officers will this Friday graduate from the Rwanda Defense Force Command and Staff College in Musanze district. To understand more about the college in building a professional army that is ready to deal with the contemporary security challenges, our colleague Jean-Pierre Kagabo spoke to Brigadier General Didas Ndahiro. Take a look.
This college, the Rwanda Defense Force Command and Staff College, is the premier institution in the RDF. It has two parallel courses. One is Junior Command and Staff course, attended by captains up to majors, and their police equivalents. And the senior course, the Senior Command and Staff course, attended by majors up to colonels and their equivalents in national police. There is no doubt that the studies studied here contribute to national security, because it is only the professional army that understands the interrelationship with other agencies that are able to maintain and secure a country. That it's a course that enables students to understand the national interests that they are meant to protect.
This is the 9th edition or intake. Could you please tell us the main results that you are celebrating now, as now you have 9th graduation?
We are now celebrating the 9th cohort of since the establishment of this college, from its inauguration by His Excellency the President of the Republic of Rwanda and the Commander-in-Chief of the Rwanda Defense Force in 2012. We have graduated 413 graduates for Senior Command and Staff course and 447 graduates for Junior Command and Staff course. Out of the 418 Senior Command and Staff course graduates, 94 come from allied countries, from the continent and beyond. And undoubtedly, it is a sign that portrays the image of the college, and by extension the image of the Rwanda.
Given the result now you have registered so far, what is your vision as institution, but also when you see the country priorities and the vision?
We intend to make it a center of excellency in the region and beyond, based on research, based and premised on the IT technologies, so that our training and education is tailored on the evolving technologies that prevail in the day.
Is it mandatory for all officers to come to this school, and when you don't come, what happens?
Ideally, every officer at that level should attend, because the knowledge given in this college is needed by every officer at that level. It may not be possible because of other reasons, but ideally, yes. And there is no refusal. If you are eligible, you are able, then you attend.
Given now the status of this college and the reputation, could you tell us about the ranking of this school compared to other colleges elsewhere in the world?
We don't rank military courses, but the Senior Command and Staff course and the qualification that we provide from here is acceptable in the entire world. And as for the East African community, the program that we offer here is standardized in East African Staff and Command colleges. So we basically offer the same package, same duration, same number of ranking, same level of officers.
Sometimes we hear that there's a graduation ceremony at this college. What does it mean, graduation happening here, 47 graduating? What does it mean really for the school, but also for the students?
The graduation means a lot, both for the students and the faculty and the RDF as well. This is because graduation, we believe that graduation, or rather the Senior Command and Staff course, is not considered as another level in officer education. it is a professional and a transformation experience that is gained by an officer that attends here. So it is a celebration. It is an achievement. To the institution, it is another group of people, professionally trained, that is injected into the professional military to enhance our deep-seated professionalization.
Thank you, our colleague Jean-Pierre Kagabo, and congratulations to the graduating class indeed. Moving on, electric taxi motorcyclists are requesting for the addition of more charging stations to make it easier for them to operate their motors. As Gabi Muvunyi reports, the Minister of Environment notes that the project to phase out fuel-powered motorcycles and vehicles is aimed at reducing greenhouse gas emissions.
In August 2020, Rwanda began the adoption of electric motorcycles. Taxi motorcyclists testified that they're more profitable than regular fuel-powered motorcycles. It costs 900 Rwandan francs to charge the battery, and I earn up to 5,000 francs from it, compared to 1 liter of fuel where I would profit 3,000 francs. I wish they could add more charging stations. In efforts to increase electric taxi motorcycles on the road, Rwanda Electric Mobility Limited, in collaboration with the Rwanda Environment Management Authority, is working to phase out fuel-operating motorcycles and introducing more electric motorcycles. The CEO of Rwanda Electric Mobility, Donald Kabanda, explains that there will be support to facilitate this project. Donors support taxi motorcyclists, and we provide them with the service of transforming the motorcycles. It costs between 700 and 800, which the taxi motorcyclists must cover entirely if they do not get support. The president of the Association of Taxi Motorcyclists in Rwanda, Daniel Ngarambe, says the motorists are content with this initiative, and he calls for the focus on facilitating both sides. And he also says there is a need for more infrastructure to ease operation for the taxi motorcyclists. Adoption of these electric motorcyclists is a way of protecting the environment. We will continue to work together to ensure that the transformation is made swiftly and they can make profits. The Minister of Environment notes that the project to phase out fuel-powered motorcycles and vehicles is aimed at reducing greenhouse gas emissions. This project is putting in action what the President promised Rwandans. What we will be doing with the private sector and association of taxi motorcyclists is working to increase charging stations. There are currently 3, but they must become more so that a person can charge their battery wherever they are. There are currently 46,000 taxi motorcycles in Rwanda, and this project has started by first focusing on the 26,000 that operate in Kigali City. Gabi Muvunyi for RTV.
This 2020-2021 fiscal year budget will come to an end on the 30th of June, and more than 20 kilometers of tarmac roads will have been completed in Musanze and Nyagatare districts. Residents say the reasons for some people relocating to urban centers like Kigali are progressively being eroded as their own home areas continue to develop. Gabi continues with the story.
Nyagatare district is one of the districts that is mostly populated after Kigali since 2016. The district has a population of more than 65,000 and has begun tarmacking most of the roads. The first phase, which was 3.9 kilometers, has been completed, while the other 14.2 kilometers is 98% done. We have teachers that have cars and they would get here covered in dust. But now they come with clean cars and shoes and can enter the schools looking clean. About 12.2 billion Rwandan francs has already been spent on the construction of tarmac roads and water draining systems in Nyagatare. The mayor of Nyagatare says the redevelopment of the city will be included in the next year's fiscal budget. That will begin in July 2021, where investors and residents have access to infrastructure that is available in other districts. People have now doubled because of the roads. They come here because they see good security and a good life here. These are mostly working class people that are paying tax, so it will really benefit us. Some residents in Musanze explain that the roads, bridges and water draining systems have all been renovated to beautify the city, which has always been a source of joy for tourists. 94% of the 4.4 kilometers and 900 meters of water drainage systems has been completed. The mayor of Musanze says there is hope that the rest of the work will be completed later this month, leaving the city more enjoyable for the visitors and the residents. It is necessary that when the housing starts coming up, the residents come and find that everything is ready. This construction will decongest everything that's around there. Since the launch of Rwanda Urban Development Project in 2016, 7.9 kilometers of tarmac road and 25.3 kilometers of water drainage systems has been constructed. It is expected to cost 100 billion Rwandan francs. This was given by the World Bank and the government of Rwanda. Gabi Muvunyi for RTV.
We'll leave it at that for today. Thank you for the privilege of your time. Have a great start to your weekend. Of course, not forgetting to remind you to do all that's required of you to stop the spread of the pandemic. Otherwise, God bless you and keep you. And until next time, I'm Gloria Mutesi. See you again soon.